St. Joseph health nurses across California are holding a day of action. They're supporting nurses who say they were suspended for speaking out over the lack of protection. CBS 2's Finnstrom is live in Santa Monica, where a swarm of officers just rushed into the hospital. Cara, tell us what happened.
Yeah, Suzanne, this just unfolded right behind us here within the last half hour. Everything calm here right now. We don't know whether the patient they brought out claimed to have COVID-19 or not, just that he was violent and they escorted him out of this hospital. But even if he didn't, in this day and age, they have to respond as if he did. Take a look. You can see the officers rushing in again, just within the last half hour again, and then escorting out that patient. Officers tell us they had detained the man earlier. We don't know why, had brought him here for some needed medical treatment, but that he became violent, hitting medical staff, then police. Again, he's been escorted away. The incident comes as nurses are set to demonstrate, calling for more protective equipment, and also showing their support to 10 nurses who say they were suspended for refusing to work without such protective gear. One of the nurses, Jack Klein. Here he is.
Some nurses are afraid to say anything. They need their job. They're single parents. They can't afford to lose their job, so they go in those rooms scared.
Klein, who has worked here for 20 years, and the other nurses say they declined to treat coronavirus patients because the hospital wasn't providing proper protection. The nurses are requesting N95 masks rather than the less protective surgical masks they say the hospital wanted them to use. They tell us their colleagues have started getting sick. 3 nurses, they say, were sent home last Thursday, another 7 in the days following, all now out on paid administrative leave pending an investigation. Nurse Mike Gullick says that weeks ago he started showering in hotels to prevent bringing the virus home to his wife and 2-year-old. He also says doctors were encouraging the nurses not to go into COVID patient rooms without an N95, and that information from doctors encouraged all the nurses to take a stand. Now, back here live, I want to give you a look at the hospital. The hospital would not comment on the suspensions, but did release a statement saying they had been following federal and state guidelines to stretch the extremely tight supplies of masks by using surgical masks for nurses working with patients when they say there was no risk of aerosol spread. The hospital also says it's been working to secure more masks and is initiating what they call an approved way to disinfect N95 masks and reuse them. So, here live in front of the hospital, about 10-15 minutes from now, we expect nurses to start arriving. And again, they will be having that solidarity call for more protective gear. The other incident we showed you this morning, DeMarco, Suzanne, just happened to unfold behind us, but that has now ended. It does underline, though, the tension here, and the concern about possible infection.